Hello everyone, welcome to US Residency Training and Beyond. I am Dr. Viswanath, Aluru, attending physician in physical medicine and rehabilitation at Oxnard Health in New Orleans. In this video, we will continue with our topic patient care. In the last video, I started a little bit about consult surveys. The reason anyone consults you is because of the expert opinion to handle certain situation, to handle a patient condition. The consult might come from an ICU setting like a neuro ICU or cardiac ICU or a surgical ICU, or it can come from an emergency room, or it can be from some other department, or it can be from some other hospital. So when they're consulting you as an intern or a resident, they're consulting your service attending that you're working with. So the first thing you have to make sure is there is actually an official consult order. You're not supposed to randomly go see patients, write your notes, because the reason why you need an official order is once you put in a document in the computer and your attending physician signs the document, the hospital will be charging the insurance companies for that service. So they need to have an official consult order. But again, remember, if it is like an acute situation, then you should just go see the patient first and deal with the consult order later. So that's why it's important to have an official order first, and then you need to know so where this patient is, like who is this patient, who is consulting you, what's the reason for the consult, you know and then those are the basic things that you need to ask, like where is the patient, what's the room number, what's the medical record number, what is the reason for a consult. And once you have that information, then you need to ask immediately, how is the patient situation, is the patient stable. It means blood pressure, heart rate, vitals, respiratory rate, everything is a patient alert oriented. So make sure that the patient is stable first. Okay, so you need to understand the location of the patient, whether it's coming from the ICU or emergency room, or it's like a hospital floor patient or a clinic patient. Where is the patient, and acuity of the situation, right? How is the patient doing right now? Because you have to divide your consults into emergent consults, urgent consults, not very urgent consults. So emergent consults are something that you have to go see immediately. Say for example, if the patient is having acute onset of weakness, it can be a stroke, or if the patient is having acute chest pain, it can be like an MI, or if the patient is having acute shortness of breath, it can be like acute hypoxic respiratory failure, or the patient is having acute bleeding. So these are the situations where you have to go see the patient first, intervene immediately, right? So that's what the emergent consults. So you gather information as you are dealing with the situation. But there are some urgent consults where the patient is stable, right? But you still have to see the patient sooner. In those situations, you can actually open the chart, gather some information quickly, like what are the reasons why the patient came to the hospital, where is the patient, and what are the vitals, any labs, any imaging, any workup has been done on this patient, and is this situation related to something the patient is already here. And then those are the things quickly you can eyeball the information in the computer and then go see the patient. But if there are not so urgent consults, then you have little more time, so you can do some background check information about the patient, about the information is already in the computer, and think about any differential diagnosis, what might be the reason why they consulted you about this situation. Okay, and then go see the patient, you evaluate, ask questions related to the situation. If the patient is unable to answer it, maybe you have to find a family member or talk to a resident or a nurse to gather the information and do your examination. And then once you have all the information, then you have to come up with the assessment and plan for this patient. Once you have all the plan information available, then you have to, because you're a resident, you still have to discuss with your chief resident or senior resident, so that they actually talk to the attending physicians to staff this consult, this patient. In some situation, you might have to call the attending by yourself, but when you are calling the attending, make sure you have all the pertinent information, findings related to this patient information or consult. So when you when you present to the attending, it has to be concise and clear, and you have to discuss your assessment and what is your plan, and then you get the information from the attending to update your plan, final recommendation, you make a note of those recommendations and inform the consulting department, whether it can be an ICU or a CCU or an emergency room or a surgical ICU, neuro ICU, or even the floor. Talk to the attending or talk to the resident. Tell them about your findings and your evaluation, your assessment, your plan for that patient. There might be some immediate medication orders that you have to put in, or immediate labs or imaging orders that you have to put in, and then there might be some follow-up labs, imaging orders, and follow-up recommendations in terms of medication management, or like a starting a new medication, right? So that's why it's important to put all the information clearly in the document. So as soon as you complete seeing the patient, you get the final recommendation from your attending, inform the consulting department, and also put in an appropriate consult note. So the consult note, on the very top of the note, you should definitely start with patient name, medical record number, the date and time of the consulting department, who consulted you, the attending physician, and the main reason for the consult. And then you start with the history of present illness, and then past medical history, past surgical history, family history, medications, any vitals, and your physical examination review of systems, any pertinent labs and imaging available, and your assessment about this patient, and what is your plan for the situation. And then once you put in all the document, and you also write at the bottom of the notes, the case was discussed with so and so attending physician, and then you sign the note and then forward to your attending physician for him or her to approve your documentation. In that way, the consulting department can act on your recommendations. Remember that there are certain situations where you write your consult note and then you sign off, so you don't have to see the patient again. You have already addressed the reason for the consult situation. But in certain situations, you have to start some workup, and the workup is incomplete, so you have to go back, see the patient, make sure workup has been done. Based on that workup, you might have to start some new medication, new treatments, and so you have to write a follow-up note. Once you start the patient on new treatment, you have to see how the patient is doing with the new treatment. Are there any management that has to be done later on? So you might have to go see the patient 2-3 times until the situation has been completely taken care of. In those situations, you might have to write some follow-up notes, maybe 2-3 notes down the road, and then sign off on the patient. So in that way, you're not fully responsible for the whole admission situation for this patient. You're only dealing with that situation that you're consulted for. So that is the consult service. So remember, the most important things are acuity of the situation, and also patient condition, and what things need to be done, and typing in the notes appropriately, and discussing those findings with the consulting department, making sure you get the appropriate recommendation from your attending physician, and writing any follow-up notes and follow-up orders, surveillance, anything that needs to be done to take care of that particular situation. So in that way, you are doing all the consultings appropriately. So the consult service, it can be as an intern, or you can be on a consult service as a junior resident, senior resident, even chief resident. If you're a rehab resident, the consult service is slightly different. So the consult service is not just for placement purposes. There is a misconception in rehab that consult service is mainly for the placement situation. That's not true. So if the patient comes to the acute care because of like a brain injury or a spine injury or a stroke or post-surgery or even acute medical condition, and if the primary service thinks that the patient has significant impairments and they cannot go home immediately after stabilization, then they consult the rehab PM&R department. So in that situation, you are not only addressing their acute impairments and their recommendations like medical management, and you're also addressing their rehab situation, rehab recommendations, saying that if you think that the patient needs intensive rehab therapy, then you might have to recommend acute inpatient rehab setting. So you are addressing both acute impairments and medical management of those acute impairments, and you're also recommending acute rehab situation, and what are the rehab reasons why the patient needs intensive rehab therapy in that situation. So that's how the consult service works for rehab residency program. So with this, I'm going to end this topic on consult service. In the next topic, we're going to discuss about admissions, like a process of admitting a patient. So far we have discussed about proper handoff, gathering patient information, pre-rounding, rounding, attending morning reports, and attending rounds. And we also discussed about call management, rapid response, code management. We also discussed about consult service. So in the future, in the next video, we're going to discuss about admission process. So I hope you all enjoy this video. I will see you all in the next video. Thank you. Have a good day.